Thanks again for sticking with us here on KXAN News at Noon. The number of veterans living in Central Texas keeps growing, and with a new VA Outpatient Clinic under construction in Round Rock, access to care is expected to become more convenient for thousands of local veterans. But even when care is available like that, navigating the VA healthcare system can be challenging. The Texas Veterans Commission's Healthcare Advocacy Department helps veterans resolve issues ranging from making appointments and handling their prescriptions to billing and specialty care, all at no cost. Joining us today to talk more about that are Dr. Horacio Maldonado, the Director of Healthcare Advocacy for the Texas Veterans Commission, and the Southwest District Supervisor, James Juarez. Welcome to you both. Thanks so much for joining us.
Thank you for having us. Thank you for having us.
So the name Healthcare Advocacy, Healthcare Advocacy Department, I want to get it right. The name says it all, but can you talk to us a little bit about what you all actually do and kind of the care that you all try to provide to people that might have some issues?
Yes, the Healthcare Advocacy Department, we have 24 offices statewide that provide, they are strategically placed so they can help veterans within the counties all over the state of Texas. And we just help the veteran process from going to the VA with any VHA issues or concerns that they have, and the advocates assist them in that process.
And what need was there to create something like that and offer that kind of help?
Their veterans struggle with going to the VA, and what the Healthcare Advocacy Department does, it provides that, that advocacy, that voice that they need to transition from the military into the Veterans Health Administration and help with other services provided by the VA.
Yeah, hopefully making that all much easier for them too.
Yes.
You know, some veterans out there don't realize that this kind of help is out there, so I'm glad that we're highlighting this today too. But what are some of the most common problems that you all help veterans resolve?
I think one of the most common problems that we have at the Austin Outpatient Clinic is going to be medical billing. That's going to be where a veteran goes to an outside care facility, and then that facility bills the veteran instead of billing the VA. So I always love it when the veteran comes to see me, so that way we can help them solve that issue. Because as you know, prices are rising, so anytime you can save a veteran some money and take a bill off his plate, they're thankful.
That would be huge help for anybody out there. We mentioned that new VA Outpatient Clinic is coming to Round Rock. Can you help us understand what kind of impact you think that will have for veterans who live here in Central Texas?
Yes, that VA in Round Rock is going to help the veterans up in the Austin area, in the Central Texas area. So it's going to be helping the other VAs, but we're going to be helping thousands of veterans more accessible to health care within that area and other surrounding counties.
And is that going to open sometime soon?
Yes, it's in progress to open up soon.
Okay,
yes.
Great. We'll follow up on that too. The department, though, I want to highlight this, helped resolve more than 16,000 cases and saved Texas veterans more than $1.5 million in billing issues. Pretty significant numbers there. So what does that tell you about the need for this kind of advocacy for them?
I believe it shows the need for us in the VA, and we need more healthcare advocates in our department so that way we can help veterans cut through the red tape at the VA. You know, the VA is a very robust system, so the more healthcare advocates we have in our department to ease the transition from veterans, I think it puts veterans in a better space to navigate the VA system. Is
the plan to try to keep growing the department and bring on more people to handle these kinds of issues?
Yes, that's the goal.
Yeah.
Do more, as much as the VA expands, it's going to require us to have more staff in the near future.
And I think it's good to wrap up the conversation and just tell people out there who might be struggling to look for an answer or for some kind of a helping hand. What would you all tell Texas veterans out there who may be experiencing that and not really realizing what kind of help is available for them?
What I would tell them is, once you come to the Austin VA or any VA here in Texas, just take a deep breath. Look for the local healthcare advocate so that way we can assist you in walking you around the VA and explaining the different facilities and how it assists you, so that way it puts the veteran at ease.
And I would imagine that help is available listed on the Texas Veterans Commission's website, is that right?
Yes, when you go onto the website, you have other departments under the healthcare advocacy tab. It shows Find the Advocate, and it's going to break it down by counties and by cities. And you have all the assistants there, frequently asked questions, and also you can submit any questions to our department.
All right, that's a good place to end it. So if people want to look for that help, it's available. Well, James Juarez and Dr. Horacio Maldonado, thank you both again for joining us here in studio. We appreciate it, and nice work out there.
Thank you. Thank you very much. I appreciate it.
All right, we'll be right back after this, so stay with us.